am Dr. Logeshwari, ND Psychiatry from Madurai Medical College. Thank you, Dr. Karthikeyan, for giving me this wonderful opportunity. As the NEETPG result were out before few weeks, I heartily congratulate all the NEETPG aspirants who had scored a very high marks in good marks in the NEETPG 2022. This video is focuses on psychiatry as a career option. I think this video will be more useful to you. This video I will make you more interesting by explaining the things in an animated form. Before choosing the psychiatry as a career option, it's necessary that 4 things we should see, and the 4 things we used to have a doubt before choosing in psychiatry. First is what is the most important thing a psychiatry resident should have? 3 things a psychiatry resident would get before taking the psychiatry as a career option. What is the routines of the senior resident, and then what are the pros and cons of the psychiatry, and the specialization and the abroad opportunities. These are the questions we will have in mind before choosing the psychiatry as a career option. This video will able to clear out all the questions which you would have. First, what is the most important thing a psychiatry resident should have while choosing the psychiatry as a career option? It's quite simple, that liking the subject. Yes, everyone knows that if we don't like the subject, it will be hell in every department. But in psychiatry, it's the most important thing. If you didn't like the subject, you can't able to understand the subjects in 3 years of residence and also in a lifetime. Because in other department, you would see the patient, you will get the versions of the patient, and you will analyze the signs and symptoms, and you will prescribe the drugs. But in psychiatry, we will see the perspective of patient, attender, and we will use our psychiatric skills, and we will come to one conclusion. So if we have to understand these things, you should like the subject, otherwise it will be quite difficult for you. And also there are certain misconceptions or there among the aspirants and along the colleagues, that psychiatrist should be very calm, very patient, very generous. He shouldn't get provoked at any cost. He should be like a saint. Is it necessarily the skill of a psychiatrist? No, certainly not. If you are somewhat calm and patient, you can very well take the subject. The most important thing in a psychiatry is, according to Gestalt, who had said that we should see the things, we should break the things into parts and see the thing as a whole, which is the most important thing for an intelligence, which is also the most essential thing for psychiatry. And also other most important questions everyone used to have is, psychiatrist will go crazy after sometimes on a continuous seeing the patient? No, certainly not. It's not a thing that psychiatrist will go on crazy after some time, which is the most common fear that psychiatry aspirants would have before choosing the psychiatry. And also the colleagues used to address it very often, that you would go crazy once you choose psychiatry as our career option. No, certainly not. It's a only subject. We can understand not only the patient's perspective, we will understand more about ourselves. So if we get a illness also, you will able to find it out very early, and also we can able to solve it accordingly. And also our senior professors used to say that psychiatry is more of neurobiology and the genetics. If any general population, if you are vulnerable, surely you will get a psychiatric illness. It's not that seeing the psychiatric patients you would get a psychiatric illness, certainly not. It's like seeing the cancer patient, you will get a cancer. It's a similar thing, I feel. It's certainly not a thing. Neurobiology is a major role in getting the illness. And also depression and anxiety is quite common in these centuries. Mm, so if you are vulnerable, damn sure in any field you will get a psychiatric illness. Being a psychiatrist, you can able to find it out very early and you can able to solve it. Another very commonest fear the residents would have is psychiatry is full of counseling. No, certainly not. It's before 20 years, psychiatrists were depend mostly on counseling, but now it's moving towards neurobiology, and many psychopharmacological drugs plays a very good role in treating the patients, and many psychiatrists were fond of psychopharmacology than the psychotherapy, because the psychotherapy is quite long, it takes so many time, and also outcome also we will get it after many years only. So many senior psychiatrists were very much fond of psychopharmacology. So don't think that psychiatry is going out of medicine. Psychiatry is always along with the medicine. It's more of medicine than the just counseling. And also another common fear the psychiatry aspirants who take a psychiatrist would have is how will we handle the violent patient. It's certainly not a thing. In due course of time, your senior PGs and professors will guide you to uh, help guide you and handle how to handle the violent patients. You will learn it quite in a period of time in 3 years of residence. So it won't be the problem for choosing the psychiatry as a career. And also next we will come to the routines of a senior resident. 8 o'clock we will go to our ward, we will do our PG rounds, and then followed by there will be the OP, we will see the OP, and followed by there will be the professor rounds. This is a routine. If we have a 24 hours duty, we will see a licensed psychiatry. Licensed psychiatry is nothing but the seeing the psychiatric patients in other wards. One quite interesting case which I had seen in my resident period is 34-year-old male who had came with depression. On examining him, there is no neurological deficits. We had prescribed tablet citalopram and we send him back home. After a few months, he started to have a visual agnosia. When we take a MRI and the antibody testing, we found that he had a demyelinating illness. So it's a quite interesting subject that many of the neurological disorder as a psychiatry as a first predominant symptoms, then the physical symptoms. It would be quite interesting in a licensed psychiatry. So if you are choosing an department, see whether there is a licensed psychiatry is there in the general hospital. If the licensed psychiatry is not there, please choose other colleges wisely, because licensed psychiatry is the most important thing one should have in a senior resident, and it would be more useful after the residentship. And then in other days we would work up the case sheet individually. Psychiatric case sheet is hard, it's a big case sheet. We should categorize the thing, we should know where to give importance, where we shouldn't give the importance. We will learn it in the 3 years of resident period. So use the resident period wisely to learn the art. And then super specialty and the abroad opportunities. Super specialty opportunities are available, but there is very less number of seats in India. It's available in PGI and immense. There is DM addiction, DM pediatrics, DM child and adolescent psychiatry, and also postdoctoral fellowship in child and adolescent psychiatry, schizophrenia, and OCD. If you are interested, you can go along with it. In India, most of the districts didn't have a psychiatrist itself. So, if you are from small cities, psychiatry itself quite enough. But if you are moving on to abroad, And also child and adolescent psychiatry is moving on very wonderfully, and also it's going on to its very great age. And also there is a limited child and adolescent psychiatrist are there in India. If you are quite interested, you can very well go for a child and adolescent psychiatry, but one major limitation is caseload. Caseload is very much less in child and adolescent psychiatry, and the outcome will not be that much better compared to general psychiatry. So before choosing the child and adolescent psychiatry, you think it twice and choose it wisely. And also abroad opportunities, many Australia, Andaman, England are very much welcoming the psychiatrist than the other specialties. If you are quite interested, you can go on to the psychiatry in abroad. And then important thing in this video is now we are coming to the most important thing, the pros and the cons of psychiatry. Pros, it's a better life place. You don't have any emergencies, you don't have any 24 hours duty, you will have the very good time in the home after completing the clinical practice, and you would have a good sleep. You don't have any stress like other department, so it's a better life place. And then second important advantage is demand supply is increasing. So which means many of them understand that psychiatric illness will be curable, so they are approaching us as early as possible, because before 20 to 25 years it is very stigmatizing. They won't reach us, they finally end up in a mental health establishment. The scenario is changing quite nicely now. And also minimum investment is needed for a psychiatry hospital opening, and also early settlement compared to other field. Cons of psychiatry, the major thing is a stigma. Though stigma has been reduced for past 20 years, still now there is some stigma is there among the public. When I take a psychiatry as my resident, my family members itself see it as a very stigma. Why should our child should take a psychiatry as a resident? Whether she will able to survive? So many of them won't give the bribe if they were a psychiatrist due to their stigma. It's certainly not a thing. And also it's also on a decreasing trend, and people is also very much curious to know about the psychiatry. So it's quite on a improving edge. And also second important disadvantage is salary and a lack of job opportunity in India, because corporate hospitals didn't consider psychiatry as a bread and butter for their hospitals. So still now there is a lack of job opportunities in India, but individual practice is quite moving out very well. So we can handle it by choosing individual psychiatry practice. So it's more of advantage than a disadvantage. And then last but not the least, there is a limited super specialty opportunities and seats. But still now the government is increasing the super specialty seats, so it won't be the trouble in after 3 years. Hope everyone would this video would be helpful for everyone on who are choosing the career as a psychiatrist. Um, if you have any doubt, just pin it in the chat box. I would able to clear it for you. Don't leave the subject due to the stigma. If you are quite interested in psychiatry, just go for it. Thank you. All the best for your future.